First impressions are priceless.
I'm Dr. Kenneth Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. I need to let you know you can see us on UVerse Channel 19, Comcast Channel 87 south of us, and WEYW19.com on the web. I'm here with Dr. Tom Morrison from Baptist Health. So let's talk about somebody who's home. They fall, they cut themselves, or they maybe broke their arm, and they call their physician and say, well, I can't see you, go to the emergency room, the hospital, or go to your urgent care facility. What happens?
Well, if they know where we are, that's half the battle, is
Right.
finding where the urgent cares are. They basically would walk and register. We take almost all insurance plans. Those who have no insurance, there's a very clear pay schedule of what they can pay for ahead of time, and they're basically seen. The process is they're checked in, they're brought back, they're seen by the physician, and usually if a diagnostic study is required, like an x-ray or labs, we do it. We can provide medication. We have a pay scale for that. Some medicines we are able to provide for free, others for $5 or $10, and they can walk out the door. So far we have 96% are in and out of the door in less than 2 hours.
Really?
Yes.
That's amazing.
Yes.
I happen to have a cousin who's a physician. He told me he went to see a physician for a orthopedic procedure. He said he was in his office for 10 hours.
We're going to see more and more of that occurring. So the urgent cares are going to be a nice resource for people to access care. The other thing too is that for insurance plans, insurances prefer urgent cares. The cost is kept down, and they reflect that for the patients too, so the copay usually is much less than an ER copay.
I've heard that patients who don't have a medical doctor or have medical insurance use the ER as their physician. Now what happens and how does that relate to what you guys are doing?
Well, you're absolutely right. A lot of people do utilize the health care through ER or urgent cares, and they're evaluated as they present, meaning when they give their credentials to the registration will give them the options.
There's a difference between urgent care and emergency care.
Absolutely.
What's the definition?
Well, I can give you the details, but bottom line is if you're having chest pain, abdominal pain, or neurologic symptoms, meaning you can't pick up a glass or you can't move an arm, that's emergent. You know, you're talking about strokes, heart attacks, possible surgical interventions required, and that requires a hospital setting. Urgent care are lacerations, infections, flu, for example. We had a big epidemic recently. It's just now tapering off. Mm-hmm. Sprains, strains, and things like that. Those are not considered emergent, meaning they're not going to be life-threatening within a few hours. They could be life-threatening in 24 or 48 hours. They do need medical attention.
Well, you know, there are all different scenarios now for medical care.
Yes.
I have another family member who is a physician who doesn't go to the hospital anymore. They're hospitalists.
Right.
I have another cousin who is a physician, does go see his patients in the hospital, and that's a big part of his practice. Mm-hmm. So this is just another avenue for patients who don't have the life-threatening emergencies but need some type of care in between. Is that right?
Exactly, exactly.
Okay. Is there a differentiation between your facilities, or are they all the same? You know what? Before we get on to that, we're going to take a break, and I'm going to come back. Again, it's Dr. Kenneth Levine with Health Talk. We'll be back in just a moment. Thank you.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenneth Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.